Hello, we are the Special Projects Committee.
We'll be presenting an article called Disempowering Parenting and Mental Health Among Asian American Youth, Immigration and Ethnicity. Now I'm going to present the presenters of this talk today. They are all pharmacy students at the University of Illinois at Chicago College of Pharmacy. My name is Jared Nelton.
My name is Eileen Pham.
My name is Ann Dam.
My name is Anna Wu.
I am Cherry Fan.
My name is Chloe Ann.
My name is Justin Chun.
My name is Melody Sa.
For the objectives of this presentation, we'll first go through an introduction and present the study, and then we'll go over the study methods and results of this study, as well as include a discussion and conclusion regarding the study.
We will be discussing the longitudinal study about parenting influences in Asian American youth. The research shows the population of Filipino and Korean American youth and study about how negative parenting has an extensive, adverse, and often long-lasting impact on mental health of the youth. The study is important for those who are stereotyped as overachievers and docile, yet feel low self-esteem and social anxiety.
These outcomes can be attributed to tiger parenting, or as called in this study, ABCDG parenting. ABCDG stands for abusive, burdening, culturally disjointed, disengaged, and gender prescriptive parenting. This kind of parenting leads to a fractured identity where Asian Americans feel a lack of agency in their lives through a duty to their family and high parental expectations. Abusive parenting includes emotional or physical abuse. Emotional abuse can mean psychological control and shaming children when expectations are not met. Burdening parenting is when children feel pressure to repay their parents for investments into their future. Here, children are expected to succeed academically and marry someone with high academic achievements so that affection seems conditional to successes in this area. Personal sacrifices to care for parents and elders as they age are also expected. Culturally disjointed parenting refers to a culture or generation gap, where there are differences in beliefs about respecting elders and parental authority. Disengaged parenting is emotional neglect or failure to validate children's feelings and not trying to understand them. Finally, gender prescriptive parenting is parental expectations of their kids to fill gender roles. Girls tend to face more restrictive parenting around sexuality and family obligations.
The primary goal of the study is to present the relationships between this prevalent parenting and youth mental health. On the basis of that, the ultimate goals are to help formulating bicultural parenting approaches that are helpful to youth development and to reduce vulnerability to mental distress. Besides, it also aims at delineating group-specific and shared aspects of Asian American parenting and informing the development of effective clinical interventions. The long-term goal of the study is to improve outcomes among Asian American families.
The data for this study was obtained from the Midwest Longitudinal Study of Asian American Families project. In the study, the participants were recruited utilizing phone books, schools, ethnic churches and temples, ethnic grocery stores, and ethnic community organizations. The participant pool consisted of approximately a 50-50 split of Filipino and Korean American youth and parents. These youth averaged around age 15 with an approximately even split of males and females. The parent was majorly the biological mother of the child at an average age around 45 years old and lived an average of 16 to 21 years in the United States. The first set of data, labeled Wave 1, was collected by a verbal questionnaire by bilingual persons in 2014. And the second set of data, called Wave 2, was collected from the same individuals, but in 2016, and 79% of the original participants were retained. Wave 2 data was collected by an online or mail questionnaire that included English, Korean, or Tagalog translations. The study methods used involved questions under each ABCDG variable targeted toward the youth being assessed. For example, for questions that fit under the abusive parenting category, we would see a question such as, "My mom severely punishes me when she is angry." Some of the questions are yes or no, and some of them are on a number scale. The questionnaire also included dependent variables of the mental health status of the youth participant, which included depressive symptoms, and suicidal ideation. After the collection was complete, each subdomain, ABCDG, was linearly regressed with the mental health status questions to see the correlation between the specific domain and the mental health of the youth participant. Wave 1 data was primarily used to see how current disempowering parenting affected the youth's mental health, while Wave 2 data was used in conjunction with Wave 1 data to see how the results from 2014 impacted the results from 2016.
The descriptive statistics of this study are shown in this table. The means among the ABCDG subdomains were compared against depressive symptoms as well as suicidal ideation and attempts. As you can see on the first row, descriptive variables include mental distress outcomes by ethnicity. The results highlighted in yellow indicates that Filipino American females reported significantly higher in being culturally disjointed, gender prescriptive, and overall depressive symptoms in Wave 1 and 2. Filipino American females also reported to have higher depressive symptoms and suicidal thoughts in Wave 2. Suicidal ideation rates for Filipino American females are 12.44%, and Korean American females are at a slightly lower 10.36%. Reported suicidal thoughts correlated with higher abusive and disengagement, burdening pressure to succeed with conditional affection, insatiable expectation, culturally disjointed, and gender prescriptive parenting. Burdening with harmony and sacrifice B1 negatively correlated with depressive symptoms.
A regression analysis was performed where each subdomain was individually regressed on each dependent variable, which consists of depression and suicide ideation. Significant variables were highlighted in yellow with at least a p-value of less than 0.05. Therefore, abusive and disengagement, burdening with harmony and sacrifice with conditional affection, and insatiable expectation, being culturally disjointed, and the difference in gender predicted higher depressive symptoms. Burdening with harmony and sacrifice, B1, did not significantly predict more mental health problems, but actually less depressive symptoms with a p-value of 0.06. Coefficients of control variables were not reported because they were not significant. These results of the full model agree with the results of the descriptive statistics as well as the regression models in terms of abusive disengaged and culturally disjointed. When the control variables and all subdomains were regressed together, abusive disengaged and culturally disjointed showed to be jointly significant on depressive symptoms as shown by the values 0.26 and 0.16 in Wave 1. These same variables also had p-values less than 0.1 in Wave 2, meaning the predictors explain later mental distress above and beyond the effect of prior level of mental distress. Abusive, disengaged, and culturally disjointed were significantly associated with higher suicide ideation at Wave 1, with values of 1.66 and 0.53 respectively. The odd ratios for suicide ideation are shown on this table, with values of abusive, disengaged, and culturally disjointed greater than 1, indicating greater odds of association with the exposure and outcome.
In discussion, abusive, disengaged parenting is the most severe associated with poor mental health and suicidal ideation. It's distinctively the most significant and to have the highest degree of accountability among other subdomains of ABCDG parenting. However, collectively with other subdomains, when examined, it was determined that abusive and disengaged parenting behaviors are distinct from Asian American parenting, with the reason being that parental control can be implemented with supportive reasoning, in which case it is not associated with being detrimental to mental health among Asian American adolescents.
Burdening parenting is one of the most significant indications of Asian American parenting. However, when coupled with abusive and disengaged parenting, the detrimental effect of parental pressure to succeed is minimized. Additionally, depressive tendencies among participants' endorsement of harmony and sacrifice for the family are found to not be correlated.
Culturally disjointed parenting is associated with intergenerational conflict. Although the results differ between the first and the second wave, this is still considered to be a major factor in its negative effects on Asian Americans. There are many inconsistencies that exist within Filipino American parents, which can cause culturally disjointed parenting and family stress. The means to reconciliation is still up in the air for the future research.
Gender prescriptive parenting has negative associations with mental health and strongly correlated with higher depressive symptoms. The full model demonstrated how the negativity of gender parenting is absorbed in parent-child cultural conflict and how it affects both Filipino American and Korean American youths.
In conclusion, this study explores the commonalities in parenting values and behaviors across Asian American groups, further integrating the issues of culture, family, and gender among Asian American families. ABCDG parenting is an influential stressor affecting Asian American youth mental health.
By acknowledging the effect of ABCDG parenting on adolescents' mental health, are able to utilize and adapt the information into specific treatment for depression and suicide prevention. For example, the Aware Intervention. Their mission is to improve the mental and sexual health of Chinese American, Vietnamese Americans, and Korean American young women in a manner that is sensitive to their unique cultural experiences and challenges. This research has opened up many different pathways for advanced research to be conducted, specifically focus on the different pathways of mental health distress in which each Asian American subgroup experiences differently from one another.
This is the article that we have been referencing throughout the presentation. If you would want any more information, you have the opportunity to look more in detail into this article.
Hello everyone! We would like to thank you for your time watching this video. My name is Chia Lee and I'm currently a P3 and the Vice President of Asian Pharmacists Association. I'm the person in charge of overseeing the Special Projects Committee and the video editing. Please feel free to contact us if you have any suggestions or improvements. Once again, please subscribe our channel and stay tuned for more videos.